Hello everyone and welcome to the channel, and today we will discuss about Rh factor. Rh factor. So Rh factor is an antigen that is present in the RBC. The antigen was discovered by Landsteiner and Wiener. It was first discovered in Rhesus monkey, so the name Rh. There are many Rh antigens, but only the D antigen is more antigenic in human. The persons having D antigens are called Rh positive, and the person who have not this antigen are called Rh negative. So 85% people of the Asian origin or Asian population are Rh positive and 15% are negative. The percentage of Rh positive people in case of American blacks are 95% and African blacks are 100%. So the Rh group is different from the ABU blood group system because the antigen D does not have corresponding natural antibody. This antigen does not have any corresponding natural antibody. However, if Rh positive blood is transfused to a Rh negative person, in that case for the first time there is no complication, but for in the second following the second transfusion there is a complication, and on the other hand there is no risk of complication if Rh positive person receives Rh negative blood because it does not have any antigen. So the inheritance of Rh antigen is it is inherited. It is a dominant factor. It may be homozygous Rhesus positive or heterozygous Rhesus positive. Now transfusion reactions due to Rh incompatibility. So if a Rh negative person receives Rh positive blood for the first time, the effect is not that much, but Rh antibodies develop within 1 month of transfusion in the body of the person having the Rh negative blood. So the transfused RBCs which are still present in recipient bloods are agglutinated. Agglutination means clumping. So these agglutinated cells are lysed by the macrophages. So sometimes a delayed transfusion reaction occurs, but it is usually mild. However, antibodies developed in the recipient remain in the body for the lifetime. So when this person again receives, when Rh negative person receives Rh negative person again receives Rh positive blood for the second time, there is transfusion reaction because Rh antigen present in the donor's blood react with the antibodies which was previously formed in the recipient's blood, react together and causes transfusion reactions. Now there is a transfusion reaction named as hemolytic disease of newborn. So it is a disease in the fetus and newborn characterized by abnormal hemolysis of the RBCs. It is due to the Rh incompatibility. Rh incompatibility. That is the difference between the Rh blood group of the mother and the baby. Hemolytic disease leads to a disease named erythroblastosis fetalis. So the disease is characterized by presence of erythroblast or immature blood cells in red blood cells in blood. So when a mother is Rh negative, mother Rh negative and child Rh positive, in that case, for the positive, because of the child may be Rh positive because he has got the antigen from his father, he or she has got the antigen from the father. So usually the first child escapes the first child escape the complications of Rh incompatibility from the Rh incompatibility, because the Rh antigen cannot pass through the placenta from the baby to the mother. However, during delivery, the Rh antigen from fetal blood leaks into the mother's blood because of umbilical cord. So during postpartum period, that is within a month after the delivery, the mother develops the Rh antibody in her blood. So when the mother conceives for the second time, and if the fetus happens to be Rh positive, the Rh antibodies from mother blood crosses placental barrier and enters the fetal blood. This is because Rh antigen cannot crosses placental barrier, but Rh antibody can cross it. So there is agglutination reaction between Rh antigen antibody from the mother's blood and Rh antigen present in the fetal blood, which leads to rapid destruction of RBCs due to hemolysis. So for this, to compensate, the bone marrow release large amount of immature blood cells named as proerythroblast, and because of this the disease is known as erythroblastosis fetalis. So ultimately, due to excessive hemolysis, severe complications develop, such as severe anemia due to hemolysis, then hydrops fetalis, carnicterus. So hydrops fetalis is a serious condition in fetus characterized by edema, which ultimately leads to cardiac failure and even death. And carnicterus is the brain damage in infants caused by severe jaundice due to excessive hemolysis and breakdown of hemoglobin into bilirubin. If the baby survives the anemia in erythroblastosis fetalis, in that case carnicterus develops because of high bilirubin content. So the blood brain barrier is not the blood brain barrier in the infants is not developed properly. So the bilirubin enters the brain and ultimately causes permanent brain damage. So how we can prevent this transfusion reaction? First of all, if the mother is found to be Rh negative and the fetus is Rh positive, in that case anti-D and antibody is should be administered to the mother at the 28th week and 34th weeks of gestation as a prophylactic measure. And if the Rh negative mother delivers Rh positive baby, then anti-D should be administered to the mother within 48 hours of the delivery, either before delivery or within 48 hours of delivery. This develops passive immunity and prevents the formation of antibodies in mother's blood. So the anti-D cancels the formation or prevents the formation of Rh antibodies in mother's blood. So the hemolytic disease of newborn does not occur in a subsequent pregnancy. And next process is if the baby is born with erythroblastosis fetalis. In that case, the treatment is given by means of blood transfusion. How? The Rh blood is transfused into the infant, replacing infant's own Rh positive blood. It will now take at least for the 6 months for the infant's new Rh positive blood to replace the transfused Rh negative blood, and so by this time all molecules of Rh antibody derived from the mother get destroyed. So this is all about Rh factor and the incompatibilities of transfusion reaction due to Rh incompatibility. And here I am ending my today's video. See you in my next video with another topic. And if you guys like my videos, please subscribe the channel. Thanks for watching.